Thanks so much for the introduction, and I'm really honored to be leading off the conversation here. The topic of usability really touches on a lot of different areas. So throughout my brief time, I'm going to touch on some of the concepts that are going to go into greater detail by a lot of the other speakers. So I'm really focused here on the impact of EHR usability on clinical documentation. And we already kind of did introductions, and I'll see if I can get the slides to cooperate. Okay. Already went over. I don't have any industry funding to disclose. Already talked about my overall funding. So I always like to just make sure that we're all on the same page as we talk about usability and what is usability. So some of the more common definitions that are out there, when we think about the integration of human factors engineering and understanding how humans work within a system, is that the usability can be defined as the degree to which something is able or fit to be used. So that's kind of a complex definition, and even uses the word used in use definition. But I like to think of it, is it easy to use, and do I make mistakes? So if I'm sitting there and I'm concentrating on it, maybe I'm in a lab setting, maybe low stress environment, does it do the things that I expect? If I type here, if I click on this, does it work? And how likely am I to make a mistake in that kind of a setting where I'm focused on it? So we often see these as lab test environments or use case scenarios where we test the different health IT systems, or whether it's consumer electronics or whatever device. I always like to keep in mind, though, there's this differentiation of usefulness. So the quality or fact of being useful. And that's a different set of questions, nuanced, that are you actually going to use this item, and how will it work under real world conditions? And I work clinically in the emergency department. And so we sometimes see devices and health IT systems that maybe worked in a lab test environment, or in a very controlled environment, or maybe even in a different healthcare environment. But once you put it into the real world conditions where there's interruptions, things don't quite work, maybe the patient's got a problem list that's got 200 items on it, what does the system really look like, and how does it work under those conditions? And we need to keep both of those in mind. And I want to preface this conversation around health IT usability and EHR usability, that it's not any one person or one group or one organization's responsibility. It's really everyone's responsibility as we design these systems, especially as we implement these systems, and then as we monitor long term. Things change, there's updates, there's maybe new use cases, especially as we talk about the integration of health information exchange systems and those types of data in our documentation. We need to be kind of constantly reevaluating and looking for the usability and usefulness of these systems. So I'd like to touch base on the impact of EHR usability. And so this was a study that my research team did several years ago now and published, where we were looking at the usability of CPOE, the computerized provider order entry systems, and looking across a number of tasks. And this was in a lab environment, in a simulated environment, but it was across multiple EHRs and multiple healthcare organizations. And you don't have to get into the details, but the length of the bars here is showing the variability and the number of the amount of time it took to accomplish different tasks, whether it was ordering tests, diagnostic imaging versus laboratory tests versus medications. And so you can see the kind of light purple, pink colors are one particular EHR vendor. The brown is a separate vendor, and each site was represented by its own set of bars. And so we could see differences even between systems, between healthcare organizations, and also between vendors. And a lot of that has to do with those implementation decisions of the system and have major impact on the usability of those systems. And we start looking at impact on clinical outcome, a lot of data here, but really the focus is on that bottom right-hand corner, where depending on the usability of the system, again, this is across multiple sites, multiple vendors, we were seeing error rates upwards of 50% in a laboratory setting, in a simulated setting. So you're not getting interrupted, you're not getting phone calls, you're not taking care of 10 patients at once. You're really just sitting in front of the computer and being asked to perform a task. And we were seeing error rates of upwards of 50% depending on the particular task. So usability is critical in how we as clinicians enter the data, and then certainly the downstream effects on usability of that data that gets entered. When we think about how documentation gets into the system, I think, at least for me, oftentimes I'm thinking, the typing, the dictation, the processing of that data using NLP that we'll talk a little bit about later. Those are kind of the classic things that we think about and often focus on. But we also need to be thinking about other types of documentation that are getting into the system. That might be scanning of notes. There's still certainly a transmission of paper records between maybe healthcare organizations, or a patient brings in some important documentation from home that needs to get into the record. There's more and more images and videos, how we document things rather than my chicken scratch of trying to draw a wound on a patient. I can take out my phone that's linked to the record and take a picture of that patient's wound that communicates a lot more information and documentation around what's going on with that patient, rather than another type of input, or me trying to type out a description of the injury. Videos more and more, primarily around kind of procedures, but certainly those can play a role as we move more towards telehealth. And then I think lastly, the other type of documentation we need to be considering are from outside sources, that this is much more of an ecosystem than things were previously with EHRs and health IT systems, that there's information exchanges, there's third-party applications and mobile tools. I think I saw that pop up in the chat earlier. And then certainly medical devices, as there's tighter integration around cardiac monitoring equipment, or again, procedural devices in a particular OR setting. We want to be able to make sure that documentation is all tightly integrated into the EHR and documented in a usable and useful way, and then that we can get that information out in a usable and useful way. This was a photo that Dr. Bob Weirs took a number of years ago. And we always like to look at this in the context of all these clinicians in the transition that they had in this particular health system from the electronic health IT system. And you might not be able to, I might be blocking it depending on where my video feed is on the screen there. But in the upper right-hand corner is the newly installed health IT tracking board. And on the left-hand side is the dry erase board that had kind of developed over time at that institution. And most EDs had dry erase boards up until the recent past. And yet everyone is kind of gathered around and communicating using the dry erase board rather than the health IT tracking board that was supposed to replace it. And we've come a long way since this photo was taken a number of years ago. And that kind of basic human factors design around user interface has greatly improved in the majority of health IT systems out there. The things like font sizes, icons, colors and contrast, layout, much of that has been kind of figured out in the human factors world, in the consumer electronics world. People like to talk to the major smartphones as a great example of relatively ease of use, although not always. And so that has largely been worked out, and there's good guidelines around that. But the thing that we're really struggling with, it really does have an impact on the usability around documentation, are these cognitive task support, this kind of second bin of elements. Workflow design, visualizations, memory aids, error anticipation. These are all critical areas that need to be supported in the health IT systems. And if we're not supporting the workflow of our frontline clinicians, then there's going to be suboptimal documentation. There might be more likely to be things like copy and paste we'll hear about a little bit later. So we want to be thinking about not just, does it look good and can you drop the text in the right area, but how do we integrate this information? I'm going to give some examples of where those challenges are. The first one is kind of a schematic of a health IT system, and a challenge that was kind of seen during implementation process. So bear with my drawing here. I try to do my best. But on the left-hand side, we have a default implementation of health IT system where you've got screen after screen after screen, 7, 8, 10, 12 screens long of data for the documentation process. And so at the top, you're going to have kind of basic information. And the idea is to have all the information on one page, but there's not enough screen real estate to show everything. So you have to kind of scroll through things. And then the actual documentation of what the physician is thinking is all the way down at the bottom of the screen. So you can imagine how challenging that might be, that if you get all the way down, you scroll down, you go to document, you say, oh wait, what was that at the top of the screen? The lab test, the prior visit, the cardiology report. Either I could try to remember it and put it in, or maybe I need to scroll back up and go. And so it's almost like a football diagram of kind of running all over the place, back and forth, up and down, until you get all the documentation done. You might buy a larger screen, put the screen in a different orientation so you can see more, but there's still a lot of this up and down. And after the go live period, the implementation teams had taught a couple of the staff that, hey, you know what, actually you can change the orientation of the screens. The system has kind of anticipated this problem, and you can create two columns. And that's kind of the right side of the screen, where you can make this a lot easier, where you've got your documentation on one side and then all the data and info on the left-hand side, and you can kind of scroll independently. And so really supporting that cognitive workflow of a clinician, kind of going through the record and reminding themselves and not requiring them to remember and memorize all that information. This was a manual process and not the default configuration. So even years later, in this given health IT system, new physicians that log in and kind of get set up with an account as they come in are having to set this up, or maybe someone looks over their shoulder and says, oh, hey, you know what, you can make your life a lot easier if you just kind of make this 5-second configuration. And so again, the system supports better usability, but the way that it's implemented at a given healthcare organization ends up reducing the usability of documentation. And again, people maybe are rushing through things. They don't take the time to go back up and tag those particular elements or pull information from the chart so that the notes themselves are better down the road and more useful. Another type of document.
Hey, Zach,
Yes.
I'm sorry, it's Patty. You're not going to believe this, but you're about out of time.
Okay, great. I only had this last slide, and then I'm pretty much done.
Oh, wonderful! Thank you.
And so this last piece here was around the use of macros that we know are a challenge. I think they're going to go into a little bit deeper. Are there ways that we can configure these things so that they are a little bit easier to read, and you're not just hunting and pecking through the data? So we know that there are challenges around, duplication of data, bloat, and kitchen sink approach of dumping everything in. And the last piece was, as I've mentioned, kind of future challenges around pulling in HIE data, patient-reported outcome measures, pulling that data in, documentation, and then, as I mentioned before, those mobile applications, pulling in watches, smart scales, all those types of things. So with that, thank you for the time, and I'll hand it off to the next speaker.